A very good morning to you, Nqobile. Speak to us about the conversation that will be taking place today, also in light of the decisions that have been taken by the U.S. administration under the leadership of Donald Trump.
Well, Aldrin, it's very important to note that the decision made by Donald Trump will be affecting millions of lives, especially those that rely on the research and understanding of what tuberculosis is and how many people are affected by this disease. It's already reported by WHO that over 1 million people die from this disease. And at the same time, in South Africa, just alone, in 2023, it's reported that over 270,000 cases were reported. On top of that, 56,000 people died. So it does give you an idea of how many people are affected by TB. So today we are expecting then the minister to engage us in terms of what's going to happen with regards to that research, what happens on the ground, and also just to have those minds that are doing the research and people who are behind this to tell us what is the way forward. However, whilst we are discussing that, I want to bring in Prof to speak to us about this killer, really. I mean, we can see how this impacts a lot of people, but the question is, how are you most likely to be infected by TB?
Yeah, thank you so much for this question. It is very important. You get tuberculosis by sharing airspace with a person or people who already have tuberculosis. So this could be in a home. Maybe you got a small home, you share small space, your big family, or you're traveling in public transportation, you happen to be next to somebody with tuberculosis who's coughing on you, you can get it.
And which areas are most likely to be affected? Do we know in the country?
So tuberculosis is everywhere in South Africa, but we know that in the metros, city of Johannesburg, city of Ekurhuleni, city of Cape Town, and eThekwini, and other metros, where you find large numbers of people, they live together, maybe also in informal settlement, there are problems there with ventilation, but everywhere you can get TB, particularly in those places, in the congregate settings. There are a lot of problems, there are a lot of transmission in those areas.
And I suppose this speaks to the importance of doing the research then to ensure that there's a vaccine going forward and people can be saved. Then, which brings me to my next question then. With regards to the people that have been affected, we understand that there are those that cannot be helped in terms of medication. Why do we have those that are resistant?
So the resistant tuberculosis, which you call multi-drug resistant tuberculosis, this is a disease where the strain that you get, or the microbe that get infected, is resistant to the strongest drug, generally, rifampicin, which is the strongest medicine for treatment of drug-susceptible tuberculosis or ordinary tuberculosis. So if you get infected by someone who has resistance strains, you would get it. But a small number of people get resistance because they do not adhere to treatment. That's a small number, but generally it is transmitted and it is a big problem. Although I need to say that some years ago, prior to 2017, we used to treat those people for 2 years or 18 months. But from September 2023, we introduced a 6-month regimen that is been now given to more than 95% of people with multi-drug resistant tuberculosis in South Africa. So the treatment now for multi-drug resistant tuberculosis is 6 months, just like your ordinary tuberculosis that we call drug-susceptible tuberculosis.
And I suppose there are drivers for TB. Take us through which are those?
Yeah, TB is really driven by many factors. Poverty is one of them. If you have a weak immune system, like if you're diabetic and all that, those are the factors. But the main driver is really HIV in our context. In South Africa, it is mainly HIV, to an extent that just about 55% of people who get TB, get treated for TB in the country, happen to be people living with HIV.
Thank you very much for speaking to us, Prof. Well, Aldrin, as you can hear there from the professor, we are expecting to obviously get more details with regards to how they're going to be fighting tuberculosis in the country. But the details, as he explains, for some people, it might be, you might not even know that you have you have TB. You will remember that even in the survey that was done in 2019, they found that some people actually showed no symptoms, which makes it very important for people to screen.